No day is typical as a public health nurse, and even as a nurse in general, no day is typical. But I would say on the average, you start your day looking at your caseload, looking to see who needs to be seen right away. So we have a span of, so some people you have to see within 10 days, some people 2 to 5 days, and some people need to be seen immediately. So you have to look at that and prioritize your day. You also have documentation. Yes, you still have to document, nurses. You're not going to get out of with a public health nurse getting out of documentation, but it's not as intense as in the hospital, so keep that in mind. But our job can be intense because we are dealing with people who are maybe physically abused, emotionally or psychologically abused, being financially exploited. I mean, there's just lots of different things that happen to them. So a typical day for me would be, I'll look at my caseload. Okay, I need to see 2 or 3 people that day. I need to do a little documentation. So I'll probably do that early in the morning because most of my clients are not early risers. So I don't generally get out into the field till around 10 o'clock. And so I'll get some documentation done. Then I'll go out, I'll get my county car, and I will go out and see my clients. And I try to organize my day based on where they are. So if I've got several clients that need to be seen and all but one of them is in the peninsula, then probably I'm going to see maybe the client in Salinas first and then see all the people in the peninsula. Because the peninsula, all the cities are very super close, so it's a lot easier to see them, one right after another. So I'll go and see maybe the one in Salinas. I plan an hour with each client because maybe it'll be shorter, but I want to plan an hour, especially for an initial visit, because you have to make the person feel at ease so they're willing to tell you the problems and trust you. Now, just because we're nurses and people trust us in the hospital, it's not the same in the community. You have to spend the time talking to them. So I'll spend an hour, 45 minutes with a person, then I'll go out to my car, I'll make some notes to myself. I try not to make too many notes when I'm in person with the person. Sometimes I'll ask if they've got a lot to tell me, and I'll say, is it all right? I need to make a few notes so I can remember what you're saying. And generally speaking, most people are open to that. Then I'll go out to my car, make a few more notes, and then head off to the next appointment. Generally, if I have a break between them, I'll try to catch up on my notes and put a few words in each section of my assessment so that I remember things when it comes down to documenting it in our computer program. That usually takes me close to the end of my day. So I'll try to get back to the office, or I'm currently working remotely, so I'll try to get back to my own house by around 4:30 so I can wrap up and tie some strings together and make sure that I'm ready for the next day. And I tend to make a list of, okay, so I need to see so-and-so, so-and-so, and so-and-so, and then you need to leave a gap because we get assigned cases every day, so you might be assigned one that needs to be seen quicker than what you need to see the other people on your list. So it's prioritizing, and it's always leaving time to get your documentation done, but also leaving time for an emergency, a situation where you need to go out very quickly, and that could take the rest of your afternoon. I just had one recently that took the rest of my afternoon from probably about 1 o'clock till 4:30. That eliminated me seeing any other clients. So you have to keep that in mind when you're putting your day in. But it's never boring. It's not like exciting like the emergency room, but it can be exciting in the sense that you're there helping someone, and you may be connecting with law enforcement, fire, paramedics, because you may come and find that this person needs emergency medical attention. So that could take longer because you've got to report off to law enforcement, report off to the paramedics and the fire department. And so you can count on 2 to 3 hours in that situation, depending on how long it takes them to get the person up and ready and off in the ambulance.